Hello everyone, welcome to my channel. And so today I'm going to talk about the day of the operation, and I have some videos that I shot on inside when I was in the hospital. It was my husband brought me to the hospital because they say you need to get picked up as well by someone because you can't really see. I couldn't drive. So he brought me to the hospital, and because it was COVID, he couldn't come in with me. I had to go by myself, which was fine. I checked in. They were very nice, all the nurses. They brought me to my own room, so I had a private room for me, where I went to the room before the operation to do all the checks with the nurses and talk to my doctor there before the operation. So anyway, and then I used the bedroom as well after the operation to eat, because they give you food. So before, the nurse came to my bedroom to ask what I want to eat, and then I think it was some sandwiches or something like this. It was nothing like major, but it's just that you eat before you leave. The doctor came and he talked to me. If you have an operation both eyes at the same time, the way they anesthetize your eyes is different. So if you have one eye at the time, they put a needle in the eyeball, I think, and then they anesthetize the eye. So that eye, it blacks out, so you don't see anything. Whereas when you do both eyes at the same time, they just use local anesthetic, which I was a bit worried about, because I thought, oh, maybe it's going to hurt. I don't know, because it's very different anesthesia than local anesthetic. So he explained to me that I would have local anesthetic, which was basically some liquid that they would pour into my eyes all through the operation. I told him I felt a little bit of anxious. So he said that he had an anesthetist that would put something on my blood if I wanted it. I said yes, I wanted, because I didn't want to feel fear, and I think fear is the worst. Like, if I decided to do it, so I should just do it in a way that I didn't feel like, bad about it. So then I remember to go into a room before the operation room, which was when I met the anesthetist, and he talked to me again. He asked, are you sure you want to eat? Would you like something to make you feel, my cats, they don't stop. Would you like something to make you feel more relaxed? And I said, yes, please. I thought at the beginning that they would put me to sleep or something like this, but I didn't sleep. I was awake all times, but I didn't feel fear anymore. I didn't feel worried anymore. I just felt really enjoying and relaxed. That was like really nice, something that he put it in my vein that I have no idea what it was, but it was amazing. I remember to be in the operation room and looking at the lights, and basically look at when he removed the lens, the natural lens, I could see like all blurred. So I really knew what was happening. And then I felt as well when he put the new lens inside. So basically I didn't feel pain per se, but I felt the pressure when he put in the new lens, especially on the left eye. I felt that he was like really adjusting the place and putting so much that I said, oh, it's hurting a bit. It wasn't hurting. It was just, I feel just the pressure. And then he just said, "I'm really sorry." I said, "No, that's fine. I wanted that he was doing the right thing, not to stop, you know, but I don't know, I just felt a little bit pressure, especially on the left. On the right was fine. I felt pressure, but not uncomfortable pressure. But it was so nice because the doctor put like some nice music in the background, so I was, you know, lying down with those lights, and every time, and it's all the time that liquid, so I felt like I was, you know, when you are underwater, that you look at the top to the sky, and then you see, it was something like that, seeing the sun through the water. So I was like, I don't know, and with all those music playing in the background, like classical music, it was really relaxing, and I could say I enjoyed the operation, except for the uncomfortable pressure I felt on the left eye, but otherwise was fine. So I left the operation room, and then the doctor, so they brought me to a room outside the operation room, which had other people sitting as well. So basically they set me out in that room, and I could see basically everything. Yeah, you can see when you come out of the operation room. And that's what he said as well. I forgot to say that when you have the one eye operation, they black out your eyes, no, because they put the anesthetic, so you can't see, but you have the other eye that is, you know, available to see. And then when you do the both eyes, they don't want you to come out of the operation without seeing, because if you had the anesthetic in the both eyes, then you wouldn't be able to see anything. So that's why they use local anesthetic, because when you come out of the surgery, the surgery, you can see everything. And that's what happened to me. I could see everything basically. And they want you to look so that you can tell them what you see and everything. So it was very nice. So they took my vitals, and then they saw everything was fine. So like after 10 minutes, I guess, I can't remember, they brought me to my room. Then I was there. Then the nurse came again. I think they checked my vitals again, like oxygen, pressure, and all that stuff. And then they gave me my food, and I left. That was and then the last nurse came, and he told me all my eye drops, how I take the eye drops, and this is like, I had lots of eye drops, and one of them was really painful. The eye drops were much more painful than the operation itself. I think some people, they don't feel this eye drop so much, but I really felt it. One of the eye drops was really like burning. At the beginning was worse, I think, because I think my eyes were healing, so it was a little bit, I don't know, it was it hurt less as the time go, but it still hurt a lot. One of the eye drop, and I talk about this in one of the videos that I talk of the after operation videos. So yeah, and then I went home, and then my husband picked me up. I went home, and that was it. Yeah, it was intense, but it was the best thing I did in my life. And the next video, I'm gonna talk about the day after my operation, how the way I saw things and the way things were settling. And I hope you enjoyed this video. If you enjoyed, please thumbs up. And if you have any questions as well, you can ask me. I'm very happy to answer. And I see you in the next video.